Skid Row, one of the largest and most stable homeless populations in the United States. Home to some 17,000 residents, estimating 3,000 to 6,000 to be homeless according to the U.S. Census Bureau of 2000. We're going to be hitting the streets out here on Skid Row to see what the quality of life is like for the residents who live here, and to see what kind of health care that they are receiving.
The density of the population, there's a lot of the population living outside in close proximity. The fact that a lot of the patients down here are immunocompromised, either from diabetes or other chronic disease, also makes them high risk.
I'm Captain V.
Can you tell us how long you've been out here?
I got here 2012.
2012.
Yes, sir.
Okay, so about 5 years.
Yes, sir.
All right.
I don't live here. This is where I command.
Have you ever seeked out any medical care from any of the facilities around here?
Only at the Martin Luther King where they was trying to fix my eye.
Martin Luther King?
Yeah, the Martin Luther King Medical Center over there by Willowbrook.
Okay.
Yeah.
When you were there, did you feel that they treated you correctly? Did you feel that you were
Yes,
treated
sir.
with respect?
They sent in the best.
Do you ever feel like you're not safe out here?
I'm Captain V.
Captain V is always safe.
That part right there.
I love it. I love it. Captain V, man, it was a real pleasure.
Thank you, sir.
Skid Row is a tough area. I outlined it here on the map in red. And just 2 blocks away, as you can see in this picture here, we got a happening in bustling market called Grand Central Market.
Gentrification, like Grand Central Market around Skid Row, has limited the amount of space for the people living there. It has also caused an increase in housing costs, leading to more people being pushed onto the street. The decrease in space and increase in population has caused a rapid increase in the population density.
Can you tell us a little bit about yourself?
I used to be a machinist for about 25 years.
How did you end up living out here on Skid Row?
Because of the war.
And you said you've been out here for 13 years, yes? Yeah. Could you tell us just a little bit about how you've felt that it's changed over the last 13 years?
Just more people came recently.
Just a little bit more people came?
Oh, yeah, a lot more.
Yeah. A lot more? Yeah. Have you ever been treated by any of the medical facilities out here?
No.
You've never been treated by any of the medical facilities?
No.
If you ever need to go to the doctor, who do you go to see?
I really don't ever need a doctor.
No? How about any of the food? Do you ever seek out any of the food places here that hand out meals?
Oh, yes.
Yeah? And how do you feel that impacts your stay out here?
Sometimes it helps out a lot.
Yeah? Do you feel that they treat you with respect?
Yeah.
Yeah? And do you trust a lot of the other residents that live out here?
Some.
Yeah? Some?
Some.
Not all?
Not all, no.
Not all.
How you doing there? My name's Jake.
Good, Kevin.
Let's start with what do you guys do here?
We serving food for low-income people every day.
And on average, how many would you say that you serve through the course of a day?
Yeah, but it depends. At least average of 100 families.
About 100 families
Yes,
a day?
yeah.
When they first come, they don't have ID. So when they come, they get their ID, they get their SS card, they get their Medi-Cal card, they get their driver license. If they need medical attention, well, we send them to the nearest clinics around here.
On a daily basis, how many people do you estimate are treated here at this clinic?
Yeah, so we see about 8,000 unduplicated patients every year. 50,000 visits a year, and so that comes out to about 1,000 visits a week or 200 a day. We are the medical home. This is a patient-centered medical home facility, so a great deal of the patients, once they come in for the first time, everybody's assigned to a primary care physician or provider the very first time they come in. That could be a PA, a nurse practitioner, or a physician. So I would say that on a given day, out of the visits that we get, that 60% are repeat and 40% are new.
And would you say that there are a sufficient amount of medical facilities out here to help the residents of Skid Row?
I think the problem that we have is that many of the people that are in Skid Row don't access care, and so I don't think we have enough outreach teams that are doing active outreach in the streets to get people into care that are already not into care. Homeless health care really is the combination of getting people into housing, that's the goal, and treating mental health, drug addiction, and primary care. So I think that when you look at capacity for mental health, capacity for drug addiction, those services are lacking, and I think the overall outreach services in Skid Row need to be enhanced. If you look at Boston's healthcare for the homeless system, for example, there really is no bricks and mortar clinic because the approach really is
Street medicine.
Street medicine.
Yeah.
And I think that if I had to name the one thing that needs to be done down here in Skid Row, that would be at the top of my list.
All the things that are important for our nation, our city, our state to understand about the homeless population and the things that we can do to make it better in terms of treatment and care. What would you say is the most important thing that people should know?
Well, I think the most important thing that people should know is that healthcare is a right and housing is a right. I think it's a crime that a country that has this much riches, I guess, the highest standard of living in the world, has such a high number of people that are homeless. And please, please, please don't take away funding for the population that needs it most.
What I learned on Skid Row was that to not take for granted how lucky I am, and a lot of us are here at USC, that we have a roof over our head and food on our table every day. And I think as future clinicians, we should always remember those facts of just how lucky we are.
Yeah, one of the things I learned on Skid Row is that it's easy for the general population to group homeless people into the category of drug addicted or alcoholics. And although some of the people who live on Skid Row do have those issues, it's important to remember that they all did not end up out there because of that, and some did end up there not by their own choice. And although the community may seem sad from the outside, there is a lot of love and there is a lot of care amongst the residents who live on Skid Row.
Before going to Skid Row, I thought that there was going to be a lack of physical healthcare clinics, but what I learned is that there's actually a lack of outreach to the community.
I feel that a lot of the residents on Skid Row feel that the system has failed them, and they view healthcare as a part of that system. I think it's our job as future clinicians to bridge the gap.